But right now it's time to talk about People's Health Clinic, all about it. And also we bring in a different doctor, somebody that does something at the People's Health Clinic each and every week. And it's so great to talk with them. We've got Sara Simonsen, who's in studio with me, and her little cute baby girl. Hi, Madeline. How are you, cute girl? She's beautiful. She's beautiful. But she's probably going to go bye-bye. But we thought we'd bring her because Sara is a certified nurse midwife. And we're going to talk a little bit about what that is and how you offer your services to People's Health. I think she's leaving us already.
Yeah, go
she's
to
so
Daddy.
damn cute.
Say bye-bye.
Bye. Oh, we were like, she'll be so good on TV.
I knew she wouldn't last. She's just starting to move.
We can just let her walk around. She'll maybe come back and visit in a little while. But she is getting to be a little bit of a mover. She's a year old, right?
Yeah, just started moving.
Super cute.
So I work at People's Health Clinic as a certified nurse midwife. We provide prenatal care and postpartum care to pregnant women in the community. And I don't do births for those women, but there are midwives at that clinic that do birth the babies.
So what is it that you're doing? What are the steps you're going through with them for prenatal care at People's Health Clinic?
So we see them for their first visit throughout their pregnancy. And then after their pregnancy, just to make sure everything's okay. And we do lab tests, screen for problems, and monitor their baby through the pregnancy.
And you've been doing it for about 8 months, you said?
Yeah.
And this is what's so neat is when we talk to these doctors on Wednesdays, is that there's so many of you that offer your services to help those that are uninsured. And it's amazing to see in 10 years the People's Health Clinic went from a little tiny clinic out of a van.
Yeah.
And now it is a beautiful facility, and it's amazing what they can offer.
Yeah, it is amazing. So that at the People's Health Clinic, they have general medicine, they have pediatrics, they do care for women in pregnancy, and they even have psychiatry, they have a naturopathic physician,
Isn't that crazy?
a physical therapist. They just have so many different types of providers.
Well, I've learned right alongside with the viewers how many providers, like you said, that the People's Health Clinic actually has and is offering to people. You'd think that if it was for, people that are uninsured and they're not able, they're only going to have these basic providers. But we're talking like a wide range of a lot of things. So how did you actually decide to get involved with People's Health?
So I had just finished my nurse midwifery training right when I had my baby. And I wasn't ready to go into a full-time practice, but I wanted to start doing some clinical work. And I live in Heber, so it was a perfect opportunity to just start working as a nurse midwife and provide something that the community needs. So.
And you do your research as well down at the University of Utah, and you're also working on your PhD, right?
Yeah.
So you're a busy woman.
I am.
How do you do this? You got a baby, and you're doing school, you're doing work, you're volunteering.
Not very much sleep, but it's all right.
We'll sleep when we're done, right?
Who needs to sleep?
You don't. I say it all the time.
Yeah.
So what is it that you do at the University of Utah?
My job title is research associate. I do research on several projects, mostly related to women's health, family planning, infertility, pregnancy outcomes. So it all kind of ties together, doing the research side and the clinical side as well.
So if people are going to come to you at the People's Health Clinic, whether they're pregnant or thinking about getting pregnant, what are some of the first things that you'll kind of walk them through?
So they come, the very first visit at People's Health Clinic, they actually have a session where they get education about what to expect in pregnancy, what's normal, what to eat, what to avoid. That's before they even see us. We will draw labs. They'll get a physical exam. Most women will get a pap smear at their first visit. And then, we talk with them about where they can deliver and their delivery options, and then see them throughout their pregnancy.
And really help them so that they have that healthy delivery.
Exactly.
And that they know what's coming up. I know that I've got a friend that's actually due in a couple weeks. And so when she goes to an appointment, she'll tell me things and I go, really?
Yeah.
That happens in pregnancy?
Yeah.
What? Oh my gosh.
I think that's a huge thing, is helping people know a lot of things are normal, but people don't know they're normal. Certain aches or pains, or and there's things you can do to help. Nausea and vomiting is really common, but there's certain things that can help. And so.
Oh, really?
Yeah.
Like what?
Ginger is one thing. There's also medications if it's severe. So
I don't know much about pregnancy.
Well,
so this is all news to me.
The truth is, for me, before I had a baby, I knew about it. But having a baby, being pregnant, now I really understand.
You can really help
when
them
a woman's like, I've been feeling nauseous, I say, I totally know exactly what you're going through. So.
I know how you feel.
Yeah. So it's all those things. I think to help women know what's normal and what's not, but also sometimes I think we worry when we're pregnant, so it helps when someone tells you, oh, that's really common in pregnancy.
So, and I want to hear it from you. I've had the opportunity to get to know, those behind the scenes at People's Health and really helping out to provide me with these interviews each and every week. And I've also gone to some of their parties, their big 10-year anniversary, things like that. They seem like they're so much fun.
Yeah,
so much fun. I'm amazed at how lively and excited they are to really help people. And maybe share from your experience what you see, working there.
Yeah, I guess I would just say I think when you get people together who are there and they're passionate about their work and they're all volunteers, it's just a very happy place, and people are there because they want to be. They're not there because they have to. They're choosing to give of their time. And
absolutely.
It's just a great place.
Yeah, absolutely. I totally agree with that. If people are wanting to see a certified nurse midwife, is it you among others, or is it kind of the twice a month thing that they schedule around?
Yeah, it's every other Wednesday we see our patients. They would start out seeing myself or one other midwife, and then depending on where they deliver, then they would kind of see a different midwife, depending on their plans.
And if you are uninsured, whether it is for, maybe you are expecting or thinking about getting pregnant, if it's any of so many other things that you need help with, if you go to their website, it'll really help you out. You just go to peopleshealthclinic.org, and it will tell you everything they've got, where they're located. It's really, really helpful.
Yeah, it is. And it's for people of Wasatch and Summit County that are uninsured. So,
which is awesome.
If you need health care and you're pregnant, don't be shy. It's the place to come.
Come in and see Sarah, and you look like you'd be so nice to help get them through that. It's a stressful time. It's important that people want to stay educated and know what's going on. Yeah. So, and having just had a baby, I'm sure now it's...
Yep,
you can show them the ropes.
It's all in my head because I've been there.
She's got it.
Exactly.
Sarah's got it. So make sure you check out the website also. If you do need to go there, it's there for you. And we want to thank you, among so many other doctors and providers, for what you guys do for the health clinic. So thank you. And your little baby, as cute as she was, she didn't last long.
No, I knew she wouldn't.
We were like,
she's on the move.
Get a toy. Maybe she'll stay longer. No. She's a walker now, so she's bolting.
That's right.
So, well, thank you so much for coming in, Sarah.
Thank you.